Let's talk about a home sleep study. So many patients will qualify for a sleep study that can be done in the comfort of their own home. This is something that we discuss at a sleep medicine appointment or even can talk about with their primary care provider. And once we have determined that somebody is appropriate for a home sleep study, then we talk about having them educated on the ease of the equipment and what that looks like. You are sent home with 3 pieces of equipment. The first piece of equipment for a home sleep study is the part that wraps around the chest, monitoring and recording the respiratory events that occurred during the night of the study. This piece here is a pulse oximeter that connects to your finger and monitors your oxygen level and your heart rate. The second piece of equipment looks like oxygen tubing and is able to go right by the nose and monitor air pressure. There is nothing going in, but it is simply recording the pressure of events and if there is a decrease in airflow. The third piece of equipment is this blue belt that also connects to the monitoring system. Once this is in place is when the sleep study starts recording. What's nice about this equipment is that it's very user-friendly and it is run through a battery. So there is no need to plug in any equipment. You can get up to use the bathroom and sit back down to go back to sleep without having to worry about having to disconnect from an outlet. Once you wake up for the day and you disconnect your equipment, the sleep study is completed. All the data that is collected the night of your study will then get analyzed by a sleep medicine physician. All that data will then be returned to us in an interpretation to show us if you have sleep apnea. If that test is positive, we can reliably say you have obstructive sleep apnea. We oftentimes will go through these results with you in person or over the phone to discuss and clarify any questions about the night of the study or about the results. The other thing that should be mentioned is that if there is any problem with that equipment the night of your study, we always have somebody on call to help talk you through any of the struggles. You also have an education appointment prior to taking this equipment home that is very brief and makes you feel more comfortable with the pieces that will be on you that night. One thing that we have heard from our patients that have completed sleep studies is the amount of ease as well as comfort of being in their own home to be able to have the study completed. This prevents people from avoiding the sleep study due to the fear of having to have a ton of equipment or being outside of their home to sleep.